types of births are special and magical and wonderful, and you should be so proud of yourself for the birth experience that you and your baby will go through. Whether it's an induction or a cesarean or a vaginal birth with a tear or an episiotomy, you should be so proud of the birth that you and your baby will go through and the journey that will bring you together and that will help you hold your baby in your arms. It's important to have a detailed birth plan. However, it's also important to be flexible on the day for what might arise on the day. It's arguably one of the biggest, most wonderful experiences of your life, and it's important to be open to the journey and to what might happen on the day itself. Your healthcare team will always work as a team in order to support you. Your midwives and obstetricians and others will work as a team in order to give you the safest, most beautiful, most wonderful birth that will be the best in your situation. The first thing I wanted to discuss is a beginning of labor at home, so your contractions starting at home, starting gradually, versus an induction of labor. A lot of women experience their contractions starting slowly at home, starting with period-like pain, period-like cramps, and then slowly building up. Labor thrives on happy hormones. So make sure that you do things that increase your oxytocin and things that make you happy. Things like hugging your partner, warm showers, sitting on the birth ball, doing yoga, eating foods that you like, enjoying chocolates. Do things that will increase your happy hormones and promote labor. It's important to do things that are active, so things like standing upright, moving around, in order to help your cervix dilate and help your body progress through labor. Sometimes, especially because it's your first baby, sometimes you may have some questions, and you can contact your midwives or go to the hospital if you have any concerns or any questions that you want answered, especially if your water breaks, if you experience any vaginal bleeding, if you feel like you need some support or pain relief, or if you have any other questions. You can always call your midwives. Your midwives will always be available over the phone in order to answer any questions that you have and give you any support that you need. When your contractions are lasting for 30 seconds and are 5 minutes apart, then you should probably also contact the hospital to see if you should go in. Towards the end of your labor, your healthcare team will give you resources about how to time your contractions, about the stages of labor, and there are wonderful apps that you can use in order to stay informed about that as well. Some women might get induced if labor doesn't start spontaneously. Induction can have many forms, and it can be done if your labor doesn't start at 41 weeks, if your waters have broken without labor starting, or for other reasons. Approximately 1 in 2 women will have an induction, so this is something that's completely common and very normal. I personally had an induction with my child. An induction can happen through various methods, such as artificially breaking the waters around your baby, oxytocin through an IV drip in your arm, a balloon catheter, which is inserted in your cervix, or prostaglandin gel. Your healthcare team will always support you in making the best decision for you and your baby. Your well-being is their central concern. The second thing that I wanted to discuss is assistance during a vaginal birth. There are 3 ways in which assistance can be provided by your obstetricians and midwives during birth. This can include an episiotomy, forceps, or a vacuum. Forceps are really gentle little hands that can be used in order to hold the head of your baby and in order to gently guide them out of the birth canal. This can sometimes be done with an episiotomy. A vacuum is more commonly used in labor than forceps, and a vacuum is a small plastic cup that is attached to a suction device, and this small, gentle plastic cup can be inserted into the vagina and can hold your baby's head and again, gently guide your baby's head out of the birth canal. An episiotomy is a cut that's made in the perineum, the tissue between the vagina and the anus, and sometimes that's necessary in order to make the opening a little bit bigger for the baby or in order to facilitate forceps or a vacuum delivery. A local anesthetic is always used in order to make that happen, and you might need stitches afterwards in order to promote healing. The stitches will dissolve by themselves, and your healthcare team will help you to ensure that you use the right pain relief options in order to be comfortable. The third topic I wanted to discuss is a cesarean birth. So cesareans can be an emergency cesarean or a planned elective cesarean. Cesareans are also very common and a very normal way for many women to give birth. In Australia, around 40% of births are by cesarean. So you nearly have a 1 in 2 chance of having a cesarean. It's a very normal, very common way for women to give birth. A cesarean is a major surgical operation, and it involves a cut in your tummy and a cut in your uterus as well. And the obstetrician would help your baby come out of your tummy through that cut. And usually what they do is they put the baby on your skin straight away to promote skin-to-skin contact. Sometimes a cesarean is done if there's any concern for your or your baby's well-being, if labor is not progressing for any reason, if there's a life-threatening emergency that would require a cesarean. Your team will always make the best decision for you and your baby, and they will always explain all the steps involved and all the reasoning, and you can ask as many questions as you need. If you need an interpreter, it's always important to request an interpreter and to make sure that they're there. Obstetric trauma is real, especially if you don't have control over this process. So make sure that you feel empowered, that you feel supported by your team, and that you ask any questions that might arise. Usually, cesareans are done under partial anesthesia, and in those cases, you are still awake and you can see your baby immediately when they're born. The midwife will help you with breastfeeding after, and sometimes your baby might need special care nursery or might need some care after delivery. And sometimes some babies after a vaginal delivery or a cesarean delivery might need to go to another hospital for a neonatal ICU. Again, your team will guide these options and will support you with choosing the best option for you and your baby. I wanted to reiterate that all births are natural and wonderful, and you should be so proud of yourself for going through this life stage. Congratulations, and give yourself time to heal and time to recover. All births take quite a toll on our bodies, and it's important to give ourselves time to heal and time to bond and enjoy our new little ones.